10, 9, 8, 7, 6, 5.
Welcome to Doctors on Call. I'm Jenna Miller. There have been over 150 million COVID-19 vaccines administered in the United States. The U.S. reported a record over the weekend with more than 4 million COVID-19 vaccines administered in 24 hours, according to the Centers for Disease Control and Prevention. And the country now averages more than 3 million doses daily, according to the CDC data. Only about 18.5% of Americans are fully vaccinated, CDC data shows, and COVID-19 cases in the country have recently seen concerning increases. The state of Kansas has made the COVID-19 vaccine available to all Kansans 16 and older beginning last week. Nearly 30% of Kansans have had at least one dose of the vaccination, and over 450,000 are fully vaccinated. For weeks, health experts have warned of another possible COVID-19 surge if Americans get lax with safety measures while the country races to vaccinate more people. Although vaccinations are on the rise, health officials are concerned about a possible fourth COVID-19 wave in the United States as cases, hospitalizations, and deaths increase. Why is there still a reluctance for some to get the vaccine, and what can we do to keep yourself and others safe? We'll get some updates and more on this episode of Doctors on Call with our guest, family physician, Dr. Tyrell Summers.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas, we're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.
Dr. Tyrell Summers received his medical degree from the University of Kansas School of Medicine in Kansas City, Kansas. He completed his residency at the University of North Dakota Center for Family Medicine in Bismarck, North Dakota. Dr. Summers is board certified through the American Board of Family Medicine and is a member of the Kansas Academy of Family Physicians, American Academy of Family Physicians, and the American Medical Association. His professional interests include chronic care management, gastroenterology, pain management, and psychiatric disorders. Dr. Summers has been affiliated with Russell Regional Hospital since 2015. Our phone lines are open at 800-337-4788 toll-free if you have any questions regarding the coronavirus on today's show. Doctors on Call brings you information which may be useful to you when you see your own physician or nurse. Let's go ahead and get some questions while we wait for some of those phone calls to come in. Thank you again for joining us, Doctor.
Always a pleasure.
Now, the coronavirus has been around for a little over a year now. Why do some people, do you find, get sicker than others?
So the coronavirus is a specific virus that we've seen kind of a widespread outbreak here kind of in the Kansas area as well as everywhere else. Some people are more sensitive to the virus, especially those that are like immunocompromised or that have kind of overall general health conditions that make them at higher risk, like those that have problems with like type 2 diabetes, hypertension, heart disease. But to be honest with you, there are just some individuals even that are relatively healthy that can have complications secondary to the coronavirus, this specific strain that causes COVID-19.
And why do some people have no symptoms at all?
So some people have seen the coronavirus multiple times because it's a very common virus and is seen with like the common cold itself. And because of that, they're really exposed to it often, and their immune system remembers it and can fight it a lot more quickly and aggressively than those that are kind of more sick or those that have autoimmune disease.
Now, while some parts of this country might see surges in the coronavirus right now, Russell County and the surrounding counties seem to be pretty low. Is that correct?
Yeah, that's correct. As it stands right now, we saw the majority of our cases primarily in November and December with kind of a tail off towards the end of January. We haven't seen nearly as many cases in this last little bit. That's primarily speaking in the Russell, kind of Ellis, Trego County kind of areas are primarily there. Now in the metropolitan areas, there's still kind of been a little bit of a rise all the way up until about mid-February, but even then those numbers are starting to slowly tail down. Our biggest concern right now is with people kind of getting a little bit more comfortable with we're seeing increasing vaccine rates. People are traveling a lot more, people are getting out and about a lot more. which is good. The problem is if you haven't been vaccinated, you can become a vector for spreading the disease. And even those that are vaccinated, if they don't follow the proper guidelines and precautions, can even become a vector for disease if they're not careful.
Now, what would be the reason that somebody who has already had COVID, why would they need to be vaccinated?
That's a great question. I get that quite a bit in my clinic, to be truthful with you. Anybody who has been exposed to the COVID virus itself can still receive COVID once again, and that's primarily because of some of the variant strains that we're seeing. They change a little bit in regards to the infectivity of this virus, and so they can become reinfected because of it. For that reason alone, we encourage people that even if you've had COVID-19, you do have a little bit of a natural immunity to it, but that doesn't give you a lasting immunity that we're able to see yet in studies. The COVID vaccine that comes from both Moderna, Pfizer, and as well as Johnson & Johnson have shown that they do have some effectiveness against the variants that we've seen, and because of that, they seem to be well and should be promoted.
Now, the vaccine was produced in very little time. You know, in history, it's never been produced that quickly. A vaccine hasn't. Why would some people need to be maybe concerned about, skipped animal trials, things, there's some concern regarding that?
Yeah, absolutely. One of the biggest things that happened is the technology that's come for this specific vaccine comes from messenger RNA. And because of that, it's something that we've had known about for quite some time, but haven't really done any vaccines for it. In fact, back in 2012, when we had the SARS outbreak, they actually developed a vaccine at that point for SARS with mRNA, but because we were able to control that with health measures, we didn't necessarily need to produce that specific vaccine. And so it never really saw the light of day. It wasn't really necessary. In this case, we couldn't slow down COVID-19 because of its aggressive nature, and so we had to come back to that old technology and reuse it in a way that we hadn't before. Because of the way that the vaccine is created and made, it can be made a lot faster than just a standard vaccine, in which we need to attenuate, which means to deaden down an existing live virus. Because of that, we were able to make this mRNA vaccine much quicker. It did skip animal trials and did skip a lot of what the FDA would normally do for vaccines, but we had to do that just because of the massive number of cases of COVID-19 that we were seeing. There was a very large clinical trial for many of these vaccines though, and the individuals that were in that trial still continue to show a pretty effective kind of immunity against COVID-19, so they seem to be very efficacious, which is good.
All right, we're going to go to the phone lines. We've got Lori on the line from McPherson. Hi, Lori, go ahead with your question for Dr. Summers tonight.
Yes, my question is, I want to know if I get the vaccination for the COVID. I suffer from allergies. They have fluoride hives. We don't know what's causing them. I had an outbreak in July that went to anaphylactic shock, and I just was needing to know if I should get the shot or not.
Yeah, it's a wonderful question, Lori, and I can understand why you'd be concerned with that type of a history, especially with anaphylaxis, which is a very scary reaction that can happen to any kind of allergic kind of antigen. So my advice to you would be this. Definitely there is a huge risk when taking any kind of new substance, especially a vaccine like this. However, the biggest thing is that in the studies and in the trials so far with all three of these different vaccines, the risk of anaphylaxis has been extremely low as compared to the influenza vaccine, which we give every single year. I've encouraged a lot of my patients that they still receive the vaccine, even with a history of anaphylaxis to an allergen, but that we have to watch them extremely closely while we're administering that vaccine and even afterwards to ensure that they don't have any problems. So I would encourage you, especially after talking with your provider, to make sure that that's okay. But if you were my patient and we were sitting down together, I would still probably encourage you to have the vaccine.
Okay, back to the phone lines. We've got Katie on the line from La Crosse. Hi, Katie. Go ahead with your question about the coronavirus for Dr. Summers.
Hi, I was wondering what your opinion is of schools taking out their mask mandates for their students.
Well, thank you, Katie. It's definitely a good question. Definitely mask mandates that have been in place up to date have been extremely effective in slowing down the spread of the coronavirus. We've had studies actually that were done here in Kansas that showed that counties that initiated mask mandates early showed much higher, lower spread of the virus as compared to ones that didn't. For that reason alone, I still encourage masks to be worn. I've encouraged our school district, even here in Russell, to continue with their mask kind of coordination at this point. I think the hardest part is that people really respond negatively to the word mandate, and I understand where that comes from, but the biggest thing is to understand that those masks do make a big difference in spreading the transmission of the droplets that can carry COVID-19. So I would be very hesitant for a child to be in an area where they're not masks being worn, because they could easily pick up something like COVID-19 and then pass it asymptomatically because their immune system's robust and they could easily fight the disease by themselves, passing it on to somebody else.
One of the symptoms that you hear a lot about is the loss of smell and taste. Why does that happen?
So the loss of smell and taste happens specifically because of where the virus starts to replicate at. This occurs within the nose itself and the nasopharyngeum that's there. It causes a pretty rapid spread of that virus, and because of that, it causes damage to the tissue that's around there, primarily the olfactory nerves that help with smelling. People don't realize how much smelling actually does affect their taste, and so it kind of affects both of those in that case. Now, that's not a hard and fast rule that every single individual that gets COVID loses their smell and taste, though. There are some individuals that do and some that don't.
And how long does it typically take for those senses to return to normal?
So actually with the loss of smell and taste, it's actually one of the ones that takes a little bit longer to return. For most people that I've talked with, it's been anywhere between about 7 to 21 days after infectivity is kind of dropped. And so that's in like the first 5 days. So you're talking about anywhere between about 12 to 25-ish days where they might still have problems with kind of tasting food, not smelling the same things that they had smelled before. They can kind of suffer during that time.
We were talking in the intro about the potential of a fourth variant coming through. How do you go about dealing with that?
So the hardest part about the COVID virus itself is because it's a corona-based virus, they mutate extremely quickly. They have multiple different surface antigens and proteins that can change on the whim. And because of that, it's very highly susceptible to mutation, which causes variants to pop up. Variants can increase infectivity, they can decrease infectivity, or they can make it harder for our bodies to fight against the COVID virus itself. Because of that, a new wave with a new virus is definitely possible, which is why it's even more important now than it was even before to make sure that we're staying vigilant, that we're wearing our masks, that we're doing good hand hygiene, that we're keeping our distance between each other. Once an individual becomes vaccinated, their risk does decrease for at least severe disease, so the risk for hospitalization or death plummets. It becomes very, very low. However, that does not reduce your risk of spreading the disease, and that's very important to know.
Okay, we're going to go back to the phone lines. We've got Ellen on the line from Hutchinson. Go ahead with your question. You are live on the air.
Okay. My question is regarding my daughter, who's 6 years old, and she has vertigo. And we have been to several different doctors, including a clinic, and no one seems to have an answer on the medication that she uses or medication that will work for her. Presently, she's not in school, but she's being tutored and is making good grades in the subjects she's been taking. So what can you tell me?
That's a great question. I'm sorry, you're kind of cutting in and out here in the studio, so I couldn't quite hear everything that you were saying. I believe your question was in regards to vertigo and asking about that specifically. So vertigo is a process that happens within the central portions of the inner ear, and it kind of controls where you feel like in balance and in spinning. Because of that, it can be very debilitating. It can be awful to have. Vertigo can happen for a bunch of different reasons, to be honest with you. It can happen because of inner ear infections, because of unsteadiness, a whole bunch of reasons why. A person should really be evaluated by a doctor, and it sounds like you've tried to get answers for that. Sometimes you need to see a specialist like an ear, nose, and throat provider to kind of do some further workup and testing, because there's a lot of processes and steps that can come into vertigo and that need to be investigated to make sure of. So I'm sorry that she's had a hard time finding those answers, but I'm sure if you can talk with the provider about possibly seeing a specialist like an ear, nose, and throat provider, that would be beneficial.
Have you found that vertigo tends to maybe worsen during COVID, during the coronavirus?
Yeah, definitely. People who are chronic chronic vertigo suffering patients can have a little bit more vertigo during that time frame. One of the main processes that can cause vertigo is what's called a vestibular neuronitis, which is an inflammation that occurs around the semicircular canals within the inner ear. And because of that, it's one of the triggering factors is COVID or coronavirus itself. So it can become drastically worse for people who chronically have vertigo, for sure.
I know we're just basically a year into this pandemic, but what have you found are the long-term effects of coronavirus?
So the long-term effects for a lot of individuals that were hospitalized or had severe COVID disease revolve around pulmonary kind of function or lung function. where they're high risk for having pulmonary embolisms, which are clots that occur within the lungs that can kill portions of their lungs themselves. They also can have chronic lung scarring, and because of that, can have a difficult time with breathing and can actually progress into a form of a restrictive lung disease, which basically means that their lungs can't expand and contract the way that they normally would previously. Because of that, those individuals are often taken care of by their primary medical providers or even by lung specialists, which we call pulmonologists. They might need to have bronchoscopes, which are specialized scopes that go in and view that tissue. They also might have to be on chronic medications that help make the tissue more pliable and also allow better air exchange and better breathing. There's also been other long-term complications associated with COVID infection, though, including increased risk for heart disease, we believe, increased risk for stroke because these people become chronically hypoxic, and that can set up problems with chronic inflammation and other disease. We're still just kind of scratching the surface as far as the complications people will have for years to come.
Has there been a reduction of COVID tests given in the area, or are people still getting tested?
We're still testing people. Honestly, if anyone comes in with symptoms that sound even close to being COVID-19, we are offering testing. If you come in with a fever, cough, shortness of breath, sore throat, runny nose, any of those things, we'll definitely continue to test for COVID-19. We have 3 different methods of testing at this point, at least in the Russell area. We do a rapid COVID test, which can get a result back in 10, 15 minutes. Then we have a send-out test that we send out for a PCR-based test. That test can take about 24 to 48 hours to come back, but it's pretty definitive if it's a yes or a no. And then we have what's called a respiratory viral panel, which is a specialized test that kind of runs for all the different viruses that can kind of cause a respiratory illness, COVID-19 being one of those. The only problem with that test is that it's kind of expensive, and so some insurance providers don't want to pay for it, so we try to limit using that test if we can.
If a patient suspects that they might have coronavirus or they are having some symptoms, would you prefer them call rather than come into the clinic to spread the love, I guess?
Yeah, so definitely it's a lot easier if you call ahead of time and talk with one of our nurses. They'll normally get you set up for off-site testing, or at least get you set up to come in and be tested. Of course, if you do think that you need some evaluation by a medical provider, we don't discourage that ever and would encourage you to come in. Our clinic, as well as every other clinic in the area, as well as all the emergency rooms, already have protocols in place and have had protocols in place since this pandemic has started to help make sure that our patients who have COVID-19 are protected, but also to make sure that other patients that come in are protected as well.
What are some of the side effects that a lot of times you're hearing there's side effects after that second dose? What are some of the side effects you're seeing from those?
Yeah, so the side effects we see primarily from the vaccine tend to be like a headache, sometimes causing nausea, vomiting, abdominal discomfort, diarrhea tend to be the primary ones. There are some people who have problems with like just generalized malaise, which kind of they just don't feel good, and then sometimes they get fevers as well. Most of them can be controlled with just hydration, whether that be like good old water or Gatorade, Powerade, any of those type of electrolyte replacements, and like medications like Zofran or other things to kind of help settle down the nausea. Tylenol, ibuprofen are also great in helping reduce the kind of feeling of achiness and the fevers.
Now, after a person is vaccinated, is there any reason for them to quarantine or stay away for a while?
Yeah, that's a great question. So individuals who've been vaccinated, they're not fully immune to the disease for about 10 to 14 days after vaccination. So even though you've gotten that shot, that doesn't mean that you're immune at that one point. You need time for your body to develop the antibodies necessary to fight that virus. And so we've encouraged them not necessarily to quarantine, but to still keep distance and to make sure that they're using the proper things to protect themselves. Even once you get vaccinated and once you've got immunity, we're still encouraging those exact same things, making sure that you keep your hands washed, you're keeping your distance and wearing your mask. The CDC recently came out with guidelines in regards to individuals that have been vaccinated, that they can gather in small groups together without wearing a mask, but that they still need to keep distance to help minimize droplet spread, because again, we can still pass on the virus even if we've been vaccinated against it.
What do you find is more important, wearing the mask or keeping that distance?
The distance seems to be the most important aspect of it. Again, it's just the amount of droplets that can be there, but the mask does help reduce that risk of droplet spread as well. So in combination, they are a very good technique to use. But if there's one that's better than the other, distance is by far the best. The scientific thing is actually 6 feet is what they've told us, but truth be told is like 10, even greater sometimes is better if they're not wearing masks. So.
Have the self-quarantine recommendations changed?
Not really. If you've been vaccinated, it's changed in that you don't have to self-quarantine. If you've been exposed to someone with COVID-19, all you have to do is just monitor for symptoms, and then of course if you have any, you're supposed to report them. Individuals that are still not vaccinated though, Still the same thing. If you've been in contact with someone with COVID-19, you need to self-quarantine. The health departments direct the exact amount of time that will be. It's normally anywhere between about 10 to 14 days, and that changes if you get symptoms. So it's really important to make sure, A, that if you've been exposed to someone and you're contacted, you still continue to self-quarantine, and then B, if you start to develop symptoms, to please get tested to confirm if it is COVID-19. Because again, as we see cases continue to drop, if we don't get people in actively getting tested, we can't tell if this is truly getting better or not. So if you have symptoms of COVID, you think that you've been exposed to someone, getting tested is so crucial and important for us as physicians to make sure that we are seeing control of the virus.
At first, it was even if you maybe traveled to another state, came back, even if you hadn't been exposed, they were saying you need to quarantine. Is that changed?
Not changed for those that are vaccinated. So again, those individuals that are vaccinated, they now get new rules to play with. Individuals that have been vaccinated can now travel as long as they're maintaining social distance and wearing their masks. They're allowed to travel to any state within the domestic United States and not have to quarantine when they get back home. Individual that hasn't been vaccinated, still depending upon the state and depending upon the number specifically, may need to quarantine when they get back home. The best place to get information in regards to that is still our public health departments and their websites. So if you have any questions regarding that, contacting them would be outstanding.
It seems as though a lot of the worse symptoms, the more severe symptoms, happen to be for people who are obese. What can you say about somebody getting healthier to boost their immunity?
Yeah, absolutely. And that's something that is true just in general, to be honest with you. Individuals who are larger in weight, just like Dr. Summers, tend to have a little bit higher risk when it comes to immunocompromised state and don't have as strong and as robust of an immune system as they probably should. Losing weight definitely will help boost that and will make things a lot better. On top of that, that increases blood flow. It increases the amount of white blood cells that an individual can get to respond to an active attack. So it's really important. If you ever wanted an excuse to get back into the gym, back into workout, now's a great time to start doing that. Again, the biggest risk is you got to be careful when it comes to going to a public gym or to like a public recreational center, so that you're keeping your distance, wearing your mask, and making sure you're staying safe.
And if a person doesn't know where to start, what would you suggest?
The easiest thing, honestly, is to begin with something small, something simple. Increasing your activity ever so slightly every single day is by far the most beneficial. Whether that's a short walk, whether that's a light jog, whatever you feel most comfortable with. Don't do anything too aggressive or too hard. Studies have shown that individuals that hit it hard and do a very big workout have the hardest time trying to continue and sustain that. It's as you progress, it's baby steps towards getting there. When it comes to losing weight, when it comes to eating, I always suggest the simplest things, starting with something that's very, very small and then making your way upwards. If you have a big problem with carbonated beverages that are sugary, like Dr. Summers does, sometimes stopping those is a really good idea. And that's kind of the best way to kind of begin and get things started. Or maybe it's including more vegetables or fruit in your diet. Whether that's with 1 meal, 2 meals, 3 meals, anything helps. The smallest steps are how you begin any kind of weight loss journey that you want.
What you're saying is even doctors struggle, correct?
Even doctors struggle, 100%.
What about getting enough sleep? How important is that?
Sleep is crucial in regards to your body's own ability to heal, but also in restoring the immune system itself. We recommend anywhere between about 6 to 8 hours of sleep every single night. It's really important to help kind of get an individual rested and in order for their body to feel like it should. Sleep is best done in a cold room that's dark to make sure that there's no outside light sources that are bothering an individual. If you have problems with your sleep, it could be because of a multitude of different things, whether that be sleep apnea, whether that be insomnia, a host of different kind of things can present. So if you're having difficulty sleeping or getting those 6 to 8 hours, it's an important thing for you to meet with your provider and talk about your health so that we can help you through that.
Now, do you feel the coronavirus will be similar to what the flu is, when cases tend to go down when the climate changes and it gets a little warmer outside?
Yeah, we've definitely seen coronavirus cases increase during times when it's colder. There's kind of a cold season that we kind of use. The coronavirus was one of the ones previously that we saw. It's just this specific case is with SARS-CoV-2 that causes COVID-19 has been the ones that have been concerning as of late, obviously. But yeah, cold season is still going to be here to stay. The coronavirus could come back. I don't know if it's going to be as virulent as SARS-CoV-2, which means kind of as dangerous, but it might be. And so we've got to always stay vigilant, always stay alert. Long term, I could easily see us being able to use similar vaccines that we're using right now for COVID-19 to help immune or get ourselves immune, to other types of viruses that cause colds, which would be great. It could be to the point where every single year you're getting a common cold and influenza vaccine rather than just a flu vaccine, which again would be a wonderful thing to help minimize disease and minimize the risks that are associated with these illnesses.
Have you found that the pandemic has promoted more telemedicine appointments?
Yeah, absolutely. Yeah, it's one of the good things that have kind of come out of this pandemic. There's been actually a few things. It's been an awful year for a lot of people, and that can't be replaced. But the one good thing is that telehealth has become more on the rise. We can easily get in contact with our patients a lot easier. They can talk with their doctors over whether that be like ITV, whether that be the phone. Any way that we can communicate with you is very important.
And how does a patient go about setting up one of those appointments?
The best thing is to contact your regular provider's office to see if they offer telehealth services. Talk and tell them that you don't quite feel comfortable at this time coming into the facility and seeing a physician. If they do offer it, they'll probably give you like a medium to use, whether that's something like a program. At Russell Regional Hospital, we use a program that's through a website that's known as doxy.me, where you just log in, and then when you start the phone conversation, it shows a web video of me on the screen, and we can talk face to face like I'm talking to you right now. It's a pretty awesome service. It's pretty easy to do, and it's a great way to kind of see patients and kind of talk with people. We also do phone telemedicine interviews where we'll actually just pick up the phone and call somebody, see how they're doing, talk with them about their medications, side effects they can see. It's always better to use visual evidence if you can, but if you can't get a hold of a video, talking on the phone is just as good.
Excellent. Well, thank you so much again for joining us, Dr. Summers, talking about the coronavirus tonight from Russell Regional Hospital. On our next Doctors on Call, our topic will be eye health and concussions. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from at Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.